So diabetic neuropathy is any involvement of the nerves in someone with diabetes, which is not caused or where the cause cannot be attributed to any other reason. So essentially, diabetic neuropathy often is a diagnosis of exclusion. Nonetheless, it is the most commonest form of neuropathy worldwide, apart from, say, in certain countries where alcohol-related neuropathy predominates. Any nerve can be affected by the impact of diabetes, so it can present in many different ways. So it depends on the nerves involved. Typically, diabetic neuropathy affects the extremities, and that is the most common presentation. You get a stocking type neuropathy, which starts in the tips of the toes and progresses up almost like a stocking, but also it can involve the hands. So you can get what they typically used to call a glove and stocking involvement. However, no nerve is safe from the impact of diabetes. So depending on where the nerves are involved, you can have different presentations of diabetic neuropathy. What we call diabetic neuropathy, however, is the classical stocking type neuropathy, which is the most common presentation. It is that neuropathy that increases the risk of getting diabetic foot ulcers, increases the risk of you developing pain, and of course, you can also get other foot problems with it, like Charcot-neuropathy. You can get neuropathy in different regions of the body. It can affect the nerves that run the heart. It can affect the nerves in the gut, and therefore you get different presentations depending on the region which is predominantly involved. Warning signs of diabetic neuropathy, that's a good question. In this, I will focus on the classical stocking type distal diabetic neuropathy. Typically, many patients don't experience any signs until it's quite advanced. Even for symptoms that one would experience, these symptoms are delayed quite late into the nerve involvement. Symptoms include tingling, slight sensation differences, numbness, a sense of cramp, and likewise. Now, diabetic neuropathy does not present with severe weakness, so you don't present with sudden loss of ability to walk. And indeed, even in extensive diabetic neuropathy, the physical component, which we doctors call the motor component, isn't the predominant feature. The predominant feature is the sensory component, and loss of sensation, a loss of a position sense. Those are the more predominant signs of diabetic neuropathy. Now, that's an interesting question. Recovery from diabetic neuropathy is often asked in these scenarios. Diabetic neuropathy happens over a period of time, often years to decades. It does not happen overnight. And recovery from such damage depends on where you are in the scheme of the damage. There are nerves that mediate our sensory responses, and there are nerves that mediate our motor and more complex sensory responses. Some of these nerves, if caught early, may recover in time. But if the damage is extensive, someone's come to a light late into the illness, and where there is true loss of sensation, that often cannot be reversed. So in summary, some of the sensory perceptions can be reversed if picked up early, but the motor components or the changes that happen because of advanced nerve loss can often be very difficult to reverse or never are reversed. Diabetic neuropathy on its own does not change whether it's day or night. What changes is the discomfort or the symptoms one experiences. And typically this is worse at night because at that time the brain does not have multiple sensory involvement. So it's sort of focusing on resting, and then the pain experience is heightened. Whereas during the daytime, you're out and about, your brain is involved with multiple other things. You have the same symptoms, but because the brain is busy processing other things, you don't experience the pain to the same amount as at night when the rest of the applications are on a silent mode, so you experience. But it's not that the neuropathy is worse, it's that the discomfort, the symptom component is worse at night.